question is for the Premier. While cancer research continues to develop new and innovative treatments, the cost of these treatments continues to rise. The result is that effective breast cancer treatments remain stalled in a price negotiation with pharmaceutical companies. The existing drug approval process simply lacks transparency, accountability, and deadlines. As a result, it's taking too much time for metastatic breast cancer patients to access new treatments. Ontario is one of Canada's lead negotiators at the Pan-Canadian Pharmaceutical Alliance and the chair of the Canadian Association of Provincial Cancer Agencies. So my question to the Premier is, will the Ontario government take the lead and call for transparency, accountability and deadlines in this drug negotiation process?
Well, thank you very much, Mr. Speaker, and I thank the member for the question, and to all of the advocates who are here today, thank you so much for what you do. It's very important that we have that interaction between people who are in the community on the front line and government. Mr. Speaker, we are taking a leadership role. The Minister of Health today actually is at a federal provincial table, Mr. Speaker, meeting with his counterpart ministers across the country and with the federal Minister of Health and Long-Term Care. And Mr. Speaker, we will continue to work to make sure that we make progress on this pan-Canadian enterprise, because that is the leverage that we have, Mr. Speaker, to work with all of our provinces and work with the federal government to make sure that we get the best outcomes for people who are struggling with this disease, Mr. Speaker.
Thank you. Supplementary.
Well, Mr. Speaker, our province does need to take the lead and address the issues with the interprovincial government body. In similar jurisdictions, as the Minister of Health knows, these bodies are more transparent and have timely benchmarks in the negotiation process. So if the price of a drug is too high or it doesn't meet certain conditions, the players at the table know what needs to change and they can get back to negotiating. Unfortunately, Ontario cancer patients, like the ladies with us in the gallery today, are often left waiting in the dark for a year or even more. So many patients don't even live long enough to be able to get the treatments they need and deserve. That's simply not acceptable, Mr. Speaker. Again, to the Premier, will the government take the lead quickly and help fix this process so that patients can get access to life-saving treatments before it's too late?
Question. Thank you.
Well, Mr. Speaker, and again, I will say to the member opposite and to the advocates who have joined us today, Mr. Speaker, that the whole point of us being involved in the pan-Canadian discussion of those negotiations is exactly what the member opposite is talking about, to make sure that those life-saving drugs are available to patients in a timely way, that they have the information that they need, Mr. Speaker, and that they are affordable, Mr. Speaker, because that is the question of sustainability is extremely important, Mr. Speaker, and in fact, the Canadian Association of Provincial Cancer Agencies represents our provincial agencies and have been asked by the Minister to tackle the tough issues of sustainability. So the whole point, as I say, Mr. Speaker, of us being involved is to make sure that those medications are available, to make sure that we continue to have among the best outcomes in the world on cancer recovery, Mr. Speaker, and treatment. We will continue to play a leadership role, and again, I appreciate all of the support and the work that happens here and outside of government, Mr. Speaker.